website, princetonnj.gov. And again, we're encouraging everybody to plan ahead this year so that you're able to do those things remotely. Are there any staff announcements?
No.
Nope. Okay. Then we'll move on to our presentation for this evening, and very happy to welcome Matt Bolden to our meeting, who's the business administrator for the Princeton Public Schools. This used to be an annual tradition for the business administrator or superintendent of the schools to come present the budget in front of council. Back in the old days when the community voted on the budget, this was important because if the community ever voted the budget down, it would then fall at the time into township committee and borough council's lap to figure out. Thankfully, we don't have to be in that position anymore. But over the past several years, we've brought back that tradition because it is a useful touch point. And the Board of Ed has already passed this budget, so this presentation is not for our input, it's really for our education and just so that we can have a better understanding of what the schools are going through right now. And I think that helps us in the work we're trying to do together. So with that, I want to hand it over to Matt, and I also wanted to welcome Beth Barron, who's the president of the Board of Ed, and also Brian McDonald, who are here too, who might have some additional comments after Matt's done with his presentation. And you sent us a huge amount of slides, which are up on the town website for people to look at. You don't have to go through every single slide for us. We won't have our feelings hurt.
Yes, thank you, Mayor Lempert and council members. Very pleased to be here. I'm going to share my screen as quickly as possible. We've been having practice with this in our meetings. Just give me a second to get it up here. So I've been the school board here as the school business administrator for going into my 9th month. And I wanted to start with the fact that I've been very impressed with the collaboration between the town and the Board of Ed. That's not the norm from what I've seen in my career. And I think it's excellent. And I know we're working to keep that going forward and improve on that as much as we can. I did want to read very quickly, the mission of the Princeton Public Schools is to prepare all of our students to lead lives of joy and purpose as knowledgeable, creative, and compassionate citizens of a global society. One of the, obviously we're all aware, COVID-19, since we adopted our tentative budget on March 17th, which we did outside because it was very early stages and we wanted to continue our meetings, and it was before we were up on Zoom. We did pass our tentative budget. We are empathetic towards everyone that's been affected and will be affected by the virus and the economic downturn. One of the responses that the Board of Education has made is in the middle of this slide, and we have reduced our general fund tax levy to 1.75%, down from 2.07%, a little over almost $254,000. The governor, as we all know, is uniquely, as far as I know, it's the only state, some may have followed, but has, in the attempt to mitigate the economic crisis, has extended the fiscal year by 3 months to September 30th and shortened the following fiscal year 21 by 3 months to 9 months, hopefully to take in some of the hopeful economic upturn after we start to resume back to a normal economic society. So in that, with that point, the governor has till August 25th to revise the fiscal 21 budget message for school districts. In that time frame, we're working on contingency planning. We were still required to pass our budgets within the regular time frame. So we don't know with that, we don't know the possible loss of state revenue. We receive about $6 million a year in state aid. It's somewhat in flux due to part of it being related to special ed costs, which vary each year. It's essentially a grant that we apply for, which is open now for the current fiscal 2020. So that does vary year to year. And the state, as they like to do, prorates that award because they don't have enough to fund the whole program. So one of the things I'll touch on real briefly. So we've adopted here priority-based budgeting, which tries to get the Board of Ed away from the old mentality of just tacking on a percentage growth to all the budget lines from year to year. We start at a flat point, and it's a major process that we will work on from year to year. We always try to be consistent with our values, including collaboration and transparency with our stakeholders. So one of the major accomplishments of our budget this year was not having significant reduction of force like last year's budget, and also sustained educational quality. So one of the things is the school district has a significant commitment to equity. We will be hiring a new accelerated intervention service position, which will float amongst the schools based on the needs there. These positions help those students who are generally non-classified students but need extra help. We also are going to have a new full-time family liaison at JW Middle School, which has been repurposed from a former secretary position. So this slide really compares so we're on different calendar years, as you know, at the town. You're on a calendar year, which ends December 31st. We're on a fiscal June 30 fiscal year. So one of the things that we did not have control over, certainly, was we did pass a referendum in very late 2018, and those principal payments on that debt is coming due in this fiscal year. So if you look at the middle of the slide, you can see that the 2019-20 compared to the 2021 school tax levy has increased, and that is due to the principal payments, which must be paid. This simple pie chart shows the percentage of our general fund, which is our operating fund for the school district tax levy, versus the capital in green. So it's about 92.3% goes to operating and 7.7% to the capital fund. So the taxpayer impact, which is of clear importance to all of us as taxpayers in a community. I happen to live in the next community up to the north, Montgomery. So the tax base, the assessed value the growth has been slowing a little bit this year, the rate of growth, but it affects the effective tax rate that a taxpayer will pay. So we talk about what the average taxpayer, now there's no real average because everyone is above or below, there's renters, et cetera, but based on the average, quote unquote, approximate average taxpayer, the school tax levy for calendar 2020 will go up $259 a taxpayer. So this slide it shows in blue, it shows the general fund or operating tax levy growth percentage over the last 7 budget years. One of the things you'll note here is that the current percentage growth is the lowest over the last 7 years and significantly lower than the previous 6 years. The green line shows increasing enrollment, which has been a big focus of the school district over the last 6 months. We're in the middle of a long-term planning consulting engagement where we were gaining community involvement. It's been a little curtailed, unfortunately, since COVID-19, but behind the scenes, we're still working on progressing. And as you can see, the enrollment has been going consistently up, but in the near term, at least, we've had lower tax levy increases for the general fund. This is a very positive trend. So this big slide, this is the actual last three adopted budgets. So there's some things to note in here that the overall increase from 2020 to 2021 is slightly inflated. So it looks like there's a $4.4 million increase year over year. That's mostly related to a $1.5 million appropriation out of capital reserve fund, which can only be used, it's our fund balance that can only be used for capital projects. We are not necessarily going to spend this, but this may be appropriated for referendum issues if we need additional funds to complete a referendum project. These are the last six general fund budget revenues, comparative and how it's broken out. I really focus, so one of the things that I've brought to the table is a focus on our actual expenditures. And as you can see over here in the current slide, we are forced to budget fund balance. The state has very different rules from municipal finance and school board finances. We are by statute supposed to have a very, very, very tiny amount of fund balance. So once that reaches over 2% with some slight adjustments here or there, we are forced to budget that each year. The 2% fund balance percentage would be approximately, and that's based on your general fund levy, would be less than $2 million for us, and is not considered adequate. Their larger fund balances are needed to help to absorb unknown expenses that arise. We may be well heading into that right now in the financial crisis caused by COVID-19. Additionally, a very low fund balance at the state level of 2% would mean that we would like, or possibly, or very likely have a lower debt rating. The school board has a AAA or the highest debt rating possible. Talked about most of the things on this slide here. We did have a state aid increase, adjusted state budget of 5.37%. That was fully absorbed by increases in our charter school expense. As I mentioned before, we will get potentially revised state aid numbers by August 25th. That is the last date that the legislator gave the Governor Murphy, to revise his budget message. This slide shows our different three bonds we have outstanding. We do have significant debt that will be coming off the books during fiscal 22 here in the middle. And then a smaller piece of our debt matures in the next year. This also shows our annual debt service from year to year. This is a slide that shows our 2020, so the last 6 years, comparing our expenditures. As you can see, a very high percentage of the school district expenditures go to salaries, most of them to teachers, as you may or may not expect. About 77, over 3/4 of our budget goes to salaries and benefits. You can see back here that when the charter school expanded fiscal 18 into 19, there was a shock to the budget where the charter school expenses over the last 3 budget cycles going into this one have increased by about $2 million annually a year. So I do want to reiterate that the capital reserve amount that we're taking in the budget is a not to exceed number, and that we may not use that. We also have significant cost drivers such as special education costs in recent budgets. In past, they have been flat for a period of time and are hard to predict based on families that move into the community, that their children have IEPs, any court cases related to special ed often take up to 2 years to resolve. So we've had a short-term pressure on our special ed costs, but prior to that, we're flat for a number of years. So these are the type of unpredictable things that a school board has to deal with. Charter schools is also another thing that's grown much faster than other areas of the budget. Like I said, now there was an expansion, so we would have had to educate those students here, but the marginal cost is significantly less to take on an extra 40 or 50 students than to fund the close to $16,000 student that we pay to the charter school. Benefit increases also are a consistent driver of our budget costs. We were fortunate this year. We had a very good medical renewal rate, which helped to keep things in line. We've had increasing RX expenses. We are self-insured on the RX side and are taking active measures to slow that growth. We did hire a new insurance broker, health insurance broker this year, and have implemented a pharmacy benefit manager change effective April 1st. And we hope to save funds there. So looking forward to future budgets, you know, this budget that we've adopted a week ago, 6 days ago, a week ago, Tuesday on the May 5th is, you know, kind of a first pass of the budget. We're going to have to see what the state does if they reduce our state aid revenues. And the bigger point being is if they give indication that these are permanent increases, although it's unlikely that they will definitively say one way or another. So we're going to have to react quickly. As I mentioned before, we're working on various contingency plans to deal with those decreases if they come across. We want to also increase our advocacy at the state level. We have a lot of reviews and consulting engagements. The biggest one I mentioned was with our long-term planning consultants, Mylone and McBroom, which is still going on. We are reviewing our special ed program here at the school district. That's not necessarily financially motivated, but they are looking at the finances, but it's mainly to determine how special ed services, how well, I guess I should say, special ed services are given here in the school district. We're working on a technology plan. We're always looking at ways to do shared services better. We worked with you, the town, on that recently. We're looking to implement increased energy efficiency, which will save costs through LED lighting across the district. And all sorts of other things we're constantly looking at. I also wanted to open this up to Brian McDonald. He's the finance chair, and we worked very closely this year together. Brian, are you there?
Yes.
Great.
Yeah, if I could just follow Matt's presentation, and Matt, good work getting, you know, what was a 45-minute presentation down to 14 minutes. That was impressive. I just want to make 3 points, and Beth Barron's also on. She may have an additional point or two to make, and then we can take questions. The first is I do want to emphasize that this is a very different process than has been used in the past. The priority-based process is a significant change. It's an important change. And the other change is that we started earlier, and in past budget cycles, the Finance Committee has had limited and sometimes no involvement. And there have only been 1 or 2 board meetings where this has been a topic. This year we had 8 Finance Committee meetings and 4 board meetings where we discussed matters pertaining to the budget, and the majority of those meetings were open. So the process was a much more transparent one. The second point I want to make is that we've been working very hard to identify opportunities to save money. And in order to get to a balanced budget without cost reductions, we found in the neighborhood of $1 million of savings. More than half of those savings are recurring savings. And as Matt noted, we have more than 10 initiatives that we're focused on It may take us a couple of years to work through them, but we're committed to going line by line and identifying any opportunity to save funds and ensure that taxpayer resources are stewarded as well as possible. And then the third thing I want to note is that we're describing this as a budget. I would think of it as the snapshot one, which is every budget. You use the best information you have, and you present what you have at that time. We think it's highly likely that this budget will change, that we'll need to take a second snapshot sometime in late August or early September when we learn about the aid numbers, and also when we have a better handle on costs that we are going to almost certainly have related to the COVID-19 crisis. In addition to potentially higher operating costs, we'll find out when we're able to go back and in what fashion. But if we are doing in-school learning and remote learning, there will clearly be additional costs. And the second piece of that is that remote learning is working well. But there are many students in our general ed population and our special ed population who are falling behind. And we have an obligation to keep kids moving at an acceptable pace. And it's possible that over the summer, we're going to become aware of additional costs that we're going to need to incur in order to lift those students up who are not progressing as well as they should be and would be if school was still happening in person. So it's the case where if we saw $1 million or $2 million reduction in state aid and $1 million or $2 million increase in costs, that would have a very, very significant impact on the budget and would pose significant challenges for us. And we would need to look at three options. One is reducing our fund balance, which is small. It's at $6.3 million. It's by far the smallest of the surrounding communities, but it can act as an important shock absorber. We can look to cut additional non-compensation costs. But once those two things are done, the only other place we can look is at compensation. That's the last place we would go. And if we have to go there, we would stay as far away from the classroom as possible.
Thank you, Brian.
Thanks. All right, I did want to open it up to see if any council members had questions for either Matt or Brian or Beth. I can't see everybody, so because you're all smushed to the side. So
Why don't we take down the presentation?
Great.
Then I can see everybody. There we go.
That better?
Yeah, Ms. Fraga and then Ms. Perrin-Lambros.
Yes, my question is more specifically regarding, already we've heard also through our Civil Rights Commission and Human Services, the concern of students who may be falling behind during remote learning. And so my question related to the budget, what do you foresee being needed, and how that can be addressed now as before it's too late, as far as helping our students who may be falling behind?
Yeah, I mean, if I can answer that quickly, I think that, well, first of all, it's a great question. We know that this remote learning has not felt equally across the population, and that, certain segments of the population are having a much harder time. We do think one of the things that ahead of time was that, like I said, we were adding an AIS teacher, which will be there to help, but we've also are going to proactively offer much more tutoring and make that available to the students that have fallen behind. I think the hardest and the first thing we're going to do is try to assess, how far behind that segment of the student population you're talking about has fallen behind. And then we're going to provide as much resources as possible in a short amount of time to help those students get back to where they were.
Yeah, well, as a follow-up, I know this is a budget, the presentation is related to the budget, but for those who are falling behind, and if there's no immediate assistance, how is that going to impact them this quarter and their ability to be able to either graduate or have the credits to graduate or to move forward with, you know.
Well, I can't answer to the graduation question. That's a very unique situation. I don't believe at this time we're going to have a lot of those students affected that won't be able to graduate. However, almost more importantly is that other segment of the population, and quickly, at the end of this year, as quick as we can, diagnosing those students and getting them extra help this summer. And then as we get back into school with increased tutoring.
Okay. Thank
Ms.
you.
Lambros, did you have a question?
Yeah, and I have to say, I have a high schooler too, a junior at the high school, and it's tough. It's tough, the remote learning, and they've just been doing a wonderful job, but it's difficult. I just wanted to ask, just clarification on the state aid piece. What percentage of the budget is the state aid, and when will you find out if it's all coming through? I know there's a commitment, but we don't know for sure.
It's about $6 million a year, so it's about 8% of our budget. I'm going to say off the top of my head. I don't know exactly. It's a very small percentage overall of our general fund budget here in Princeton.
Okay, all right.
Typical with the communities surrounding us.
And we'll know about that in September, or
August 25th is the statutory date that the Governor Murphy has, and he may very well use up to that time, because I know he's very concerned with the extremely fast drop off in state revenues to come out and go ahead.
Thank you. No, I know it's a challenge. So, hopefully that will still come through at the same level. And my other question, and we don't have to take a lot of time here for this, but are you preparing, and this isn't really budget, but are you preparing for costs and a situation where you might have to stagger the days and do some additional preparation in the schools for having children not all go at the same time?
Yeah, that's kind of seems to be where we're headed. And one of the constraints, as you might figure out if you think about it, is busing. So there already are very tight constraints on busing capacity in the state of New Jersey. It's gotten a little better over the last 12 months, but there's a shortage of bus drivers. So it would probably have to be like a day on, day off, or 2 days on, some sort of rotating schedule, because adding additional busing to split the days. But yeah, we are looking at a kind of a quasi, hybrid learning process. I'm an optimist by nature. Even being a financial professional, I always try to remain optimistic. And I think that as much as we can, we should focus on some of the positive aspects that this has really, I think, enlightened us all, and how much is possible in this day and age.
Thank goodness.
I know it's challenging.
Can I just add, Michelle, that we have a committee, the superintendent has put together a committee of over, 35 people, the leadership from the administration, central office, but also our principals and our just leaders in every department, as well as the members of the Board of Health. I think George Dino is a member, and they're meeting every other week, and they're going through scenarios, and they're trying to plan for every possible way that we might be required to come back, because we don't know yet what the requirements will be, but we can start to think through some of the logistics that we know will be in question, as Matt mentioned, like transportation, or do we order some of the PPE that we may need, or do we think about how, where we have sinks and where we have bottlenecks in the buildings. And as you all know, we have a lot of space concerns already. So how do you think about that? Any sort of social distancing in the current buildings that we have is very difficult. But we have a group that's working on it. Every other week they're meeting, and hopefully that will help us be more prepared to kind of deal with what comes, because we really don't know yet what's coming.
No one does. Thank you.
Great,
Thank you very
thanks.
much.
Are there any other questions? Yeah, Ms. Niedergang?
Hi, thanks for the presentation and the information. Appreciate that. And I'm glad to hear in this time of just such vast uncertainty that you are looking at all the different possibilities. So I just have two quick questions. It seems to me, not being a facilities professional, that there are also cost savings from not having the buildings operate. For example, you don't have to air condition them. You don't have to heat them. It said, I know obviously some minimum amount of temperature or maximum amount has to be maintained. So one question is, what do those numbers look like in terms of like the cost savings versus the increased costs that you're experiencing now? And the other question, something that I remember that has come up at least a couple of years ago, if not last year, is at one point there was a focus on the schools looking more heavily into trying to raise money from alums. And I don't see that as part of the presentation. I don't know to what extent that's been done, but I know that other public schools have had good success in that. It may not be, millions of dollars, but it could be enough to offset some of the other pressures. So
those are two good questions. So we are starting to quantify some of the savings. One of the things that I'm hopeful is that, as you pointed out, some energy savings. We can't just turn off everything as we approach the humid season, but we have seen, I was looking at the bills today, there was maybe a 30%, maybe more, even 40% drop off in the April bills versus the prior month. So we're hoping that that's going to help. So some of the savings that we're having now, purchasing less supplies at the end of the year, energy savings, I don't want to discuss it in too much detail, but in negotiations right now with our transportation company, which we're going to need when we reopen. So, but we're not going to be paying that full amount of the last 60 days, starting March 16th, I think. 13th was the last day. Friday the 13th was the last day. And your second question is something that we have been talking a lot. The board especially is really, looking at that closely. I think that, in my mindset, I think that those kind of capital raises are good for, more capital one-time expenses. I think it's hard for school districts to rely on philanthropy from year to year. We have been able to get some assistance over past years to help with our MAP program to make sure that those students that qualify and can't afford devices are able to get refurbished MacBooks. But I think it's really, it's something we're going to be looking at more and more closely as we go forward.
Great, thanks. Are there any other questions? Well, I just wanted to reiterate my thanks for you guys coming, and just to piggyback a little bit on Michelle's question, just so everybody knows, we are also under the same limbo with the state aid. For the town's budget, it's a much smaller percentage, but we are still, what we've been promised is not guaranteed until the document is signed. So I think we all have our fingers crossed that the state's not going to solve its problems on the backs of the schools and the towns. I think we'll keep our fingers crossed on that. And I think, push everybody we know at the state level to do the right thing in terms of how they're going to try to solve their problems. I also just wanted to thank the district for cooperation on COVID. You had mentioned that Georgie Fernando is helping with your committee. The district has been hugely helpful to the health department by having the school nurses act as part of the contact tracing team for the town. And we're probably going to hear from Jeff Grosser a little bit later, but having nurses in the role of a contact tracer is extremely helpful, because they're more than just like your basic contact tracer, and they can help people if they have medical concerns as they're answering questions. So we truly appreciate that collaboration and all the ways that we're working together to serve the community. So thank you very much. And we know this is a tough time for you all in putting together this budget. So We appreciate your hard work on it, and there's no easy answers here, but thank you for what you're doing for our kids and for our town.
Thank you, Mayor. I just want to thank the board, the council, and you, Mayor, also for the collaboration. And I just want people to know that, we do meet regularly, and we appreciated a meeting that we had last week. And we are trying to talk about as many ways that we can collaborate and work together and find efficiencies as we can. And as we mentioned last week, if there are other ways that our personnel who are now continuing to be paid but not necessarily able to be with the students can help with any of the things with the town, we would be very willing to talk about that. So we do appreciate the collaboration. We appreciate the opportunity to come before you and to be part of your meeting and help kind of explain the basics of school finance, because it's complicated stuff. And even for those of us on the board, we appreciate Matt kind of giving us a primer on it as often as we can get, because it's a lot of moving pieces. And I also wanted to mention, just a reminder, that we are feeding over 500 kids on a daily basis in the schools. Even though we're not learning in the schools, we still are delivering food. So our school buses and our drivers and our aides are going out into the community on a weekly basis, providing breakfast and lunch. And thanks to Shops and Hunger Packing Princeton, they've been very generous in donating funds to pay for dinners for the families of our students, meals for 4 at dinner, I think 4 days a week. So I just want to mention again that that's happening. And we're grateful that we can collaborate with the other volunteers in town and try to keep people fed and connected.
Yeah.
Beth, can I mention something else that we're collaborating on? And that is doing outreach regarding the ongoing census.
Yes.
In fact, I actually have boxes of materials in my garage that I would like to get to the school district that perhaps can go into those 500 plus distribution that is being made.
Mm-hmm.
So if we can arrange that, because this is a good time while folks are sheltering in place, for those who haven't yet participated, to participate in the 2020 census.
We're happy to do that. That was a great idea.
We'll connect then. Thank you.
Thank you.
Great, thanks. All right, well, thank you so much. You guys are welcome to stay and for the rest of the meeting, but you don't have to be on camera if you don't want to.
Thank you.
Thank you.
Okay, thanks a lot. We'll see you guys soon. All right, now we've come to the public comment portion of the agenda. If you are watching this on your computer, you can use the Q&A button at the bottom of your screen. If you'd like to submit a comment for something that's not already on the agenda. If you are dialing in and listening by, you dial in if you're listening by phone. If you called in, I guess, to listen by phone, if you can send a comment to princetoncomments@gmail.com. That's princetoncomments@gmail.com, and that email address is also being monitored for comments. I'm just going to wait a few seconds to see if there's any public comments that are coming in for items that are not already on the agenda.
Mayor, I have a comment from email.
Okay.
The comment comes from Stephanie Ashland, and it indicates that I am a frequent visitor to the Ruston Center for Social Justice, and I'm happy the center is still doing community outreach at this time of crisis via social justice through the Power Hour on Facebook Live weekdays at 7 p.m. And I'd like to thank the center for doing this.
Excellent. And I'll double check. I also want to point out to people that on the princetoncovid.org website, there's a community calendar, and a lot of organizations are posting virtual events that they're holding. So it's a nice way for people to stay connected. There's still, interesting lectures going on and things like the events at the Baird Rustin Center. So it's a good spot for people to see what's going on, to connect. Are there any other comments for items that are not already on the agenda? Okay, so I'm going to close public comment and we'll move on to reports, and we'll start with council reports. Mr. Cohen, any reports for this evening?
Yeah, I have a few, but they're brief. I wanted to mention that the Citizens Finance Advisory Committee has been working with a vendor who provides fleet management. We're investigating the possible both financial improvements that could come from moving to a system with the real robust fleet management. And we had a presentation a couple weeks ago. We had a follow-up meeting last week where we discussed the specifics, and we have another meeting on the 14th with the vendor to follow up on our questions. So that's looking promising. The Bike Advisory Committee has been putting work in on developing strategies for rebalancing our streets. I mentioned this at our last meeting. Just the idea that pedestrians and bicyclists are out more, cars are out less, and with the requirements of social distancing, we're looking at ways to sort of reconfigure our streets temporarily to give the pedestrians and bicyclists room to move about safely with proper social distancing. This week, we became aware that both Sustainable Princeton and I think the Economic Development Committee or the Merchants Association have been expressing interest in working on this as well. So that we're convening a meeting for later this week where the three groups are actually going to come together and talk about how to make it all work for everybody. So that's that. I wanted to mention in terms of the energy aggregation program, which I'm sure you're all aware of, rolled out several weeks ago. The opt-out period and the opt-up period ended on May 6th. And we had a phone call with the with CNE, with the provider, and with Gable, our consultants. And they said we're about on track for the standard numbers of people who decided to opt out, which I think is good news considering some of the PR that we've been getting in the press where we've had some citizens raising concerns. We're working on updating the Q&A or the frequently asked questions section of the municipal website to incorporate responses to those concerns. And that's all I wanted to report on.
Great,
Oh, I'm
thank you.
sorry. One more
Oh.
thing. The Flood and Stormwater Committee had its first meeting since our last council meeting. It was an excellent meeting. We've formed a subcommittee that's actually going to work on the issue of updating our stormwater ordinances. There are three basic focuses of that. One is to incorporate the green infrastructure requirements of the new state guidelines that came out just a month or so ago. The second piece is seeing if we can move forward the redevelopment stormwater ordinance that Ms. Perrin-Lambros had asked about earlier in the meeting. And the third piece is to see if we can make the minor project stormwater regulations work a little bit better. We've been hearing from engineering that the rules that were put in place a year or two ago that were intended to make small projects, mostly residential projects, less impactful on their neighbors are not all working the way we hoped they would. And so we're looking to tweak that ordinance to make those work better. And the last thing that the Flood and Stormwater Committee is working on is helping with the mapping of our stormwater system that we have in town. There's a lot that we don't know about how stormwater flows throughout the town. And there's been an idea raised of doing either or getting interns to help with this mapping and or crowdsourcing mapping and actually creating a platform where residents can help to identify hotspots, locations where we have flooding and stuff like that. So now I'm done.
Okay, good. Thank you. Ms. Fraga?
Yes, thank you. The Boards, committees, and commissions have started to meet through through video conferencing, and they're continuing their efforts that are on their mission and their initiatives that they're working on, but they're just doing it virtually for now until restrictions are lifted. They wanted to make sure that that they can continue with their efforts and the initiatives that they had identified for the year. The Food Insecurity Task Force has been meeting weekly, and this is through Human Services Department that is working with community partners to address the needs of our community who are food insecure. And they're meeting weekly, and something that's very evident is that each week, as they report the numbers continue to grow of families and individuals who are in need. And so what we want to ask is both for anyone who has reached out to wishing to help with these efforts, they can contact the Human Services Department, or they can also go to the PrincetonCovid.org website, where we have identified the different resources. And this would also include the initiative. There's a program that is assisting individuals with rent and utilities. That also information can also be found on the PrincetonCovid.org website. So basically, I just want to thank all our community partners who have been assisting with the efforts, but also let everyone know that that Human Services is working to assist anyone that is in need of assistance. Just please reach out. And that's it for me. Thank you.
Okay, thank you. Ms. Niedergang?
I'll just reiterate 2 items that are on the agenda from the Princeton Environmental Committee. One, a memo, which I think we'll be dealing with momentarily, stressing that despite the COVID-19 crisis, that there are key elements on the Environmental Commission's goals for 2020 that they really would like to see put in place. And just a reminder that climate change and the crisis that is caused by that is also a disease accelerant, not only coronavirus bringing us closer to reservoirs of disease such as that, but even things like seeing ticks throughout the year. So just wanted to make sure that that's on everybody's mind. And then the other item, a resolution that's also will be coming up in a little bit later tonight, is hopefully the council will approve a resolution reiterating the municipality's opposition to the Northeast Enhancement Supply compressor station and pipeline that is looking for permission from New Jersey Department of Environmental Protection to continue with their work that is currently at a standstill. So we'll be coming to those shortly, but just wanted to reiterate that.
Great, thanks. Mr. Williamson?
Thank you, Mayor. I just want to mention a couple things, both from the Princeton Recreation Department. The first thing is, which I applaud them so much for, being that the whole COVID-19 crisis has delayed some of the regular activities that the Princeton Recreation Department would be doing. What they've done is essentially repurpose their staff to do a lot of items in-house that normally would have been outsourced because they would have been so busy now. And from doing that, they've identified literally over nearly $60,000 in cost savings from doing that. And they've already completed about $8,000 worth of work that normally would have been outsourced. So I just want to give them a shout out for that. And the second thing is also from the Princeton Recreation Department. they've been making a lot of their, or I should say making, but their staff members have been helping a lot with our many partners to address issues such as food insecurity in town, helping out programs like SHUP with picking up food and making deliveries, even getting some refrigerators from Princeton University to families in need. So certainly wanted to applaud the staff over there, the Recreation Department, for helping out extra in this climate. That's it for me, man.
Thank you. Ms. Sachs? You need to unmute.
Sorry. A couple things. The planning board held its first successful virtual hearing last week. And I want to send a special shout out to Councilman Cohen, who did a tremendous amount of work getting us to that point. Guidelines came down from DCA about how municipalities could get planning and zoning boards functioning on a digital virtual platform. But it was not as easy as it sounded on an advisory, and Councilman Cohen really worked around the clock to get us up and running in the planning and zoning department. So thank you. And let's see, the other thing is the Public Transit Committee is meeting tomorrow. We've been working with the engineer, Deanna Stockton, and Christine Symington from Sustainable Princeton to put together a proposal to the Transit Trust Fund for to explore expanded routes and what that might look like, especially as our affordable housing communities come online, how that would make sense to integrate into the existing routes that we have. And we've also been looking at moving towards using hybrid buses and hopefully ultimately electric buses. Unfortunately, with COVID, like everything else, it's thrown a big wrench into public transit. And so I guess tomorrow we're going to be talking about what it will look like for our public transit system when we start to come online, and how we could safely do that. And so I'm not sure what the implications are for all the other work that we're doing, but hopefully it won't be postponed for too long. So that's it.
Great, thank you. And Ms. Pearl-Lambros?
The Economic Development Committee met and we discussed many of the challenges that are facing the businesses right now, particularly to reopen. Including allowing restaurants and retailers to expand their spaces to accommodate queuing, waiting for appointments, for greater restaurant seating capacity. And we may, want to look at, and I think Council President Cohen alluded to this meeting, where we're going to look at, use of parks and plazas, extending sidewalk spaces. And we're also considering things like recommendations to waive various fees, to expedite, these requests for COVID-related improvements, like putting plexiglass panels, cutouts for windows, and also curbside pickup. We need to look at signage waivers, where we might need to have more specialized outdoor signage and the better ability to make more appointments or create more safe social distancing space. So really looking at all that with the Economic Development Committee. I also want to mention that there's a subcommittee on the EDC that's looking at website improvements, and their recommendations were given to the IT committee, and these are being incorporated now. Once we move forward, hopefully we're going to look at that tonight for Civic Plus. Once we move forward with a website, we'll also be looking at what ways the business community can have some input on the business portal side. And lastly, I just want to mention that we also met with the Shade Tree Commission, and we're moving forward with the Shade Tree Protection Zone Ordinance, which is designed to really help improve the definition for protecting trees on neighboring lots when construction is taking place. We've had problems in the past with that, and we're moving forward, and we have the ordinance put together. And we're also adding to that an increase in fees for the live tree removals. So, so there's quite a few initiatives that the Shade Tree Commission is working on too. So, thank you.
Great, thank you. I wanted to just take this opportunity to thank all of the landlords who've stepped forward and have agreed to work with Human Services and work with the Coronavirus Emergency Relief Fund to meet that group halfway and lower the rents so that some of the rent subsidies could go even further. And I think we've just seen a lot of people across the community really step up during this crisis. So I want to start and thank them. Thank Human Services for all of their work, and especially in helping to coordinate all the different volunteer groups. There's been some people who've come and said, why are there so many groups trying to give out food to people? And I think it's just a really wonderful thing in this community that so many people have stepped forward to try to figure out how to help in a constructive way. So I want to thank everybody who's stepped up to help. I've also been receiving emails from people who are concerned for their own health when they're out in some of our parks and trails. And there's some confusion over what the rules exactly are with face coverings. And so the rule is if you go inside of a building to shop, you need to be wearing a face covering. If you go to a park and you're on a trail, it's not the law, but there's a lot of things that we do because they're the right thing to do, even if it's not required by law. And if you're on a trail and you're close to other people, you're probably making them super uncomfortable if you're not wearing a mask. And so I'm putting in a plea to be a good citizen. You should always carry a mask with you. If you're alone on the trail, you can have it down around your neck or be carrying it. But if you see somebody, you should put it on. And it's just, I think we're starting to see it be more of the norm in Princeton that people wear it. And it's not just in a park or on a trail, but if you're going on a street where you're likely going to be sharing the sidewalk with someone, you should have your mask on. I know we're still waiting to fully understand this disease and exactly how it's spread, but it's better to be on the side of caution and to be a good citizen. So that's my plea to everybody. And I see Jeff Grosser has joined us. So I wanted to see if he had any reports for us tonight on the health department.
Thank you, Mayor. Thank you, Council, for allowing me again to report out on the COVID-19 pandemic. Fortunately, social distancing efforts in New Jersey are starting to take tremendous improvements in a few of our epidemiological trends of note. New Jersey is starting to see a decline in new total positive cases per day, hospitalizations per day, and fewer reported deaths per day. These three metrics we look at just began exponential growth in early April. And fortunately, we're seeing a larger decrease each day since May has started. And this is a time to talk about the fact that this is really a direct correlation to the social distancing measures that we've really employed throughout New Jersey, but then also the local efforts that are taking place in Princeton as well. Locally, we've been seeing a decline in new cases, although it's sporadic based upon laboratory reporting. The exception to this was the addition of something called probable cases, which we included as an offset of our total number. This included individuals that had not been tested positive diagnostically, but fit clinical and epidemiological criteria. So essentially, if somebody fits similar symptoms to COVID-19 and they're linked somehow to an outbreak or to a case that's positive, those cases are now being counted in that different positive category called probable. And this assists public health professionals with getting a better scope on the pandemic, because if not, if you think about the early 1900s with the flu pandemic, those cases weren't necessarily included in there. Or if they were included, they weren't necessarily included to this degree, you lost a lot of cases, so you didn't know the full scope. So what New Jersey's starting to do, they're asking local health departments to do this. On Friday, we started to finalize some of our case counts for this. So we wanted to make sure they were included with our total count. So that did have a little bit of an uptick there. And that was the recent increase for Princeton. In the last 8 weeks, Princeton's core staff of an inspector, part-time nurse, and 2 school nurse volunteers, as Mayor Lempert was discussing earlier, we've contacted over 150 positive COVID cases and over 1,000 contacts of those cases in order to try to suppress the disease locally. But that being said, we still need to continue to expand our contact tracing efforts, especially as the governor's stay-at-home order is slowly lifted sometime over the course of the next month. Fortunately, Princeton has had the leadership under Administrator DeShield and Chief Sutter, and they've actually provided Princeton's parking enforcement officers, who have a lot of investigative experience, to the health department team, which has added to our existing contact tracing team. So we have 6 contact tracers, which is actually exactly what the Johns Hopkins University Center for Health Security is calling for with regards to a community our size. That number of contact tracers should allow us to get to secondary or tertiary contacts of cases, which is exactly what you need to do epidemiologically to suppress a disease once you find out about it. Also, I know I had a lot of experience with Bloomberg Philanthropies through the food waste program, but fortunately, we're going to have their support again. They're actually providing a free of charge contact tracing program, which actually costs $50 per person, but it's being offset by Bloomberg Philanthropies through Johns Hopkins School of Public Health. It's a fantastic contact tracing program, and it provides them with the skills needed before they make those first calls to confirm cases and potential exposure points and cases. I also have to mention, in part due to the mayor's newsletter and the council's weekly newsletter, the health department's been inundated with an outpouring of community support, trying to volunteer both for contact tracing and really for anything else we need. And we've been so fortunate to have residents in Princeton who have both strong public health and medical backgrounds to provide this guidance and support to the department. And personally, I'm very happy to work in a town where, when you ask for volunteers, you don't find an individual that simply is from that current field. You find volunteers that have been both statewide and even worldwide leaders in that particular field. And sometimes it can be intimidating, but it's tremendously powerful once you realize their expertise and even wisdom from that field. And I'm really happy about that. So thank you all for continuing to reach out to individuals to provide support there. We're utilizing them in a bunch of different capacities. We have some individuals that will help us with long-term care centers and their communication to us, because they have to provide daily updates to us, and we have to run that data epidemiologically to see what type of trends are happening in that facility. We have to report out to the state on other data that we're finding. And then also we have to be following up on the contact tracing. So that's been super helpful. We're also looking into a contact tracing coordinator as things start to get lifted and we start to see more cases coming in. Everybody's aware also of the long-term care centers in Princeton, and that's been somewhat the epicenter of COVID, both in our community and the state, and even in the country for that matter. Both Princeton Care Center and Acorn Glen Assisted Living Center have both been battling this outbreak since early last month. We're happy to report out that they're slowly seeing cases recover and fewer positive cases each day, but they're still in great need of personal protective equipment and staffing. Princeton has made the call to both the County Office of Emergency Management and the State Office of Emergency Management for additional staffing and for additional PPE. Princeton has provided and has been very, very generous with both masks and gowns for both facilities, and will continue to do so as much as possible with our own equipment. Our OEM office has also been in discussions with the Princeton Clergy Association, who has actually reached out to us. Believe it or not, hurricane season's around the corner. And from what we've heard from early predictions from meteorologists, it sounds like it's going to be an active season. So, we're trying to get ready for something that seems like somewhat of almost an impossible situation to plan for, which is planning for a hurricane during a pandemic. And if you think about that, you have to keep social distance in place and you have to be able to shelter people. So we're trying to keep it basic and think about those two means, but we've been, again, just filled with an outpouring of support. So we're working through those things. We have a meeting with the Clergy Association coming up, and we're going to work through facility management to make sure that people are ready in the event that we have to do that. And then I'll finally close, because I said I was going to keep this brief. I have to close, and again, thanking both Princeton staff, Princeton residents, and then the community partners, specifically even the school district, for the tremendous work that has been going on the last 2 months. This has been really a difficult time for both the community, the state, and the country, grappling with something that is just still so much unknown, and we're going by things that change so readily. But the community as a whole has been abiding by the guidance, and I have to say that that's something we have to make sure we give people a lot of support and really respect for. And it's no doubt that we have a tremendous number of issues that we're wishing we could have done differently when this started, to avoid the pandemic and to even shorten it. But just remember, in 2 months, that we've really changed the course of this pandemic. And just in the last 4 weeks, we've seen numbers drastically and exponentially increase to now they're falling off almost as fast as they were increasing. And that's really in the last 4 to 5 weeks. So we have to keep this work going. And we have to make sure that as things start to get lifted, we're doing exactly what we're doing with both the school district, the business community, and really anybody else that has been closed down. We have to make sure that we're going through the planning phases to make sure that we're not going to see a surge, because as the rest of the country reopens, I think New Jersey's doing a good job of slowly doing it, but we have to do so and make sure we're communicating all the preventative measures that need to be taken place before we do so. Thank you.
Thanks, Jeff. Are there any questions for Mr. Grosser? Ms. Fraga?
Yes, Jeff, if you could please provide some guidance or clarify regarding for use of whether it's cloth mask or the PPE, especially if the PPE that's being distributed, that perhaps they're meant to be disposable, but if individuals are using them continuously for weeks, is there any guidance you can provide? And I'm asking because recently someone from one of these senior care facilities reached out to me asking for some cloth face coverings, and these are employees, which I understood they were receiving from their employer or from the health department. Should they be using cloth or the ones that are being distributed, or a combination of both?
Thank you for that question. Yeah, I think it depends on what you're doing. So if you are a individual that's just going to be utilizing a mask going to the store, a cloth mask is fine. You can reuse it. You can wash it. The senior facilities, we've actually donated, the municipalities donated N95s to them. We have not donated surgical masks to them.
Okay.
And the reason for that is the N95 is going to, I think at this point, almost everybody's a public health expert and a mask expert. But we understand that the mask is to protect the person around you, not necessarily you, unless you're wearing an N95. If you're wearing an N95, that actually protects you as well. So that's what's being provided to the senior facilities, because the staff, if a staff member tests negative and they're going to treat a person that's positive, we want to make sure we keep that staff person healthy. If we can urge people that have N95s, if they have a surplus of them, which we've received a lot of these donations, they're able to donate those to the municipality, and we're redistributing those either to first responders or to the long-term care centers, because at this point, long-term care centers have not received, the long-term care centers have received more from the municipality than the county or the state. So we're doing our best to redistribute those assets. So if individuals have those PPE, we're happy to redistribute it for them and take that out of their hands. For cloth masks, individuals can utilize those if they're going to the store, if they're going out in public, and then they can rewash those just like it would be a piece of clothing after they're done using them for the day.
Okay. And are the N95s reusable?
The N95s are not reusable by, I'll say, they are in the healthcare industry because there are means to sanitize them. For a homeowner, a resident, there are ways to sanitize them, but they're a little bit creative, I would say. We're not urging people to do that. You can reuse N95s more than one day,
Okay.
but N95s for an individual to go out in public and wear on a regular basis is very trying for the respiratory system.
Right.
We're urging people not to utilize those. It's really for the individuals that are knowingly putting themselves into a COVID-19 situation.
Mm-hmm.
And that's what I was asking specifically for the employees of these healthcare facilities
Yeah.
who have received one. So my question was whether they are reusing the same one that was issued to them, or whether they, but I think what you said, what I understood is that they are being sanitized.
Well, places that can sanitize them are sanitized, and they have to have a piece of equipment that can do it. We've donated them to Acorn Glen, which was in need of them. Princeton Care Center is not in need of them as far as we know right now, the second, but we've provided them to Acorn Glen, who was in need of them at the time.
Great, thank you.
Yeah, you're welcome.
Great, thanks. If there's no other questions for Jeff, then I just want to say thank you for your presentation, and thank you for all of your continued work. This is, you've been doing truly a remarkable job, and the municipality is truly unbelievably lucky to have you in that role. So thank you very much for all the work that you're doing.
Thank you, Mayor.
Ms. Stockton, did you have any reports this evening?
Yes, I did want to give a few reports on construction activities, more mundane information than what Jeff had to share. PSE&G is looking to resume activities with their gas system modernization program on May 18th, weather permitting. They will be looking to work on Rosedale Road between General Johnson Drive and Christopher Drive. This work's anticipated to take 2 weeks. They would be replacing, or they would be putting in a new gas main in the roadway, and then either stubbing out new services behind the curb, or extending pipe to the foundation of people's homes, but not actively switching out any gas meters within the homes at this point. That work would be delayed until the summer or this fall. So when this work is happening on Rosedale Road, traffic will be in an alternating pattern, and the work hours are 7 a.m. to 6 p.m. Monday to Friday. After they complete the work on Rosedale, they will be looking to move over to Springdale Road between Mercer and College Road. PSE&G is going to mail out notices to all of their affected customers within these work areas. And we will be putting information up on our municipal website as well. New Jersey American Water Company is also looking to come back to Princeton this month. They have restoration work to do on Edwards Place, so they are currently replacing concrete driveway aprons and anticipate milling and paving the entire road next week. In terms of municipal projects, we do have plans and permit applications that will be going into DEP this week for repairs to the Princeton landfill. In 2016, we found that the landfill was much larger than previously known. And we also found that we have 3 distinct areas of erosion on the landfill that needed to be repaired. So we're working with a consultant to get those plans into DEP so that we can get approvals to start repairs later this year. And a couple council meetings ago, you approved a construction contract for the Heatherstone project. Our contractor is currently completing some other work, so that project is not anticipated to start until July. We will be conducting a virtual meeting with the neighborhood to introduce them to the contractor and learn more about the project itself. The Harrison Street traffic signal project is on hold at this time. They have completed the work underground, and they are waiting to resume construction until they get the signal equipment. And we anticipate that will be 1 to 2 months. 2 projects more in the planning phase. One, we kicked off the Hilltop Park synthetic turf design project today. We had a virtual meeting with our consultant, and residents are advised that in the next couple of weeks, they may see some surveyors out at Hilltop Park. We'll be working closely with Recreation to make sure that alerts go out when people may be out at the park doing that work. And lastly, Verizon Wireless is interested in installing 5G infrastructure in Princeton this year. So staff from engineering, zoning, historic preservation, and planning are all involved in the discussions, and we will keep council updated on those details. And I think that's it for my updates.
Great, thank you. Ms. Sachs?
Yeah, I have a question, Deanna. You know, in this time of COVID, on the one hand, it seems like there are opportunities to do work that would not be as disturbing because we have less traffic. On the other hand, it seems that there are since more residents are working from home, as we've seen, there's been some concern about work because they feel that it's more disturbing since they have their office hours at home. And I just want to know, as things start to reopen gradually, how are we going to be balancing these two concerns? And also, I just want to make sure that we are notifying, if you could just refresh our memory on what the process is for notifying residents when work is going to be done. And especially now, since residents are working from home, I want to make sure that we do notify them in advance.
So for the utility company projects, the notification typically comes from the utility company. So PSE&G with their work prior to COVID would have gone out and put door hangings, and typically they would do first class mailings as well regarding the projects. And then we would have something up on our municipal website. So we are still putting information on our municipal website, and PSE&G is sending out those notifications by mail. The gas system modernization program that they're currently working on is an extension of last year's project. They weren't able to complete these couple of streets in part because of the Alexander Street closure. And last year they did conduct a public information center so that any of the residents within these work areas had the opportunity to come in and meet with PSE and talk about the projects. So that's the update on their project. With the water company, typically the water company operates in the same way in that they do have they do door hangings as well, and notify in that case. But Edwards Place is a little bit of an anomaly because the majority of the properties are owned by the university. I think there's only 1 or 2 properties that are not owned by the university. So for the most part, they've been working through the university to notify the tenants of the construction activities, and then interacting with the other residents as well, I think either in person or by mail. For our municipal projects, when we get to construction, we typically have a pretty good email list for the neighborhood. So I've reached out through email, like for Heatherstone, to let them know that the project is moving ahead. And in this case, also to take their temperature, so to speak, as to the potential impact of construction and if they had any concerns. And I received positive responses that, that they wanted to see this project move ahead and that this was an acceptable time for it. So unfortunately, we're delayed because our contractor had a couple of other projects to do, but it is, we have worked with them. So we'll be sending them letters by mail as well regarding when the public meeting will take place. We'll do a similar Zoom meeting with them, as well as send out email notifications to everybody.
Great,
I think
thank you.
that covered it.
Yeah, Ms. Niedergang?
Thank you, Mayor. I wanted to pick up on the work with Verizon and the 5G. I know that I have received over the last few months several emails with kind of apocalyptic things to say about 5G, and was trying to talk a couple of times with Mr. DeShields about this. I want to make sure that we really get out ahead of this. And I know the last time there were some cell tower installations, I went to the public information session. I think I was the only visitor there and I learned a lot about it. So that was great, but I'm not really the best person to present this to the public. So I want to make sure that we really have information, that we look at the kind of information that's going out on the internet and the lack of actual data that's there, and make sure that we have a Q&A explaining, like, yes, there is some radiation released, but unless you are installing them and you are working 5 inches away, it's not dangerous. And just to go through all the different possible things, and I'd like to have that done well, so that when we start to announce that this is moving forward, we have that information ready to go. And I'm good at wordsmithing. I'm not that good at science, but happy to help in any way if that would be desired. But just, want to make sure we get out ahead of the curve on that one. So.
Yeah, definitely. And that's why it's good that we have engineering, zoning, planning, and historic preservation all working together. And we'll also be pulling in our municipal attorney that helped craft our latest ordinance. I think that was just passed last year regarding these cell installations. So I guess one question I have for you, and part of why I wanted to bring this forth, is because we are now operating in this more of a virtual atmosphere. We're not going to have, say, a public information center like you had attended for the cell nodes previously. Is it more appropriate and maybe farther reaching to do this as a presentation to council when we get to a certain point, rather than saying have a standalone meeting? I don't know. We can do it
my
both
take
ways or
my take
either.
would be no. I mean, I just checked the numbers. We have 12 people in the audience tonight, so that is not a lot of bang for the buck. But I think if we push it out on like Nextdoor and Access Princeton, we had a good number of people for the information session for energy aggregation. I mean, 100 or close to 100, as opposed to 12 or 13. So I think it's good to mention it at council, but I personally don't think that this is where we're going to get a lot of viewers or where people are going to go.
I agree, but I think we should record it and then post it so that people who maybe miss it will be able to listen, even if, and maybe have the opportunity for the people who are watching it later to still ask questions and, be able to reach out. But, I think it's, I think it'll be even more important probably for us to do the communication around this. I will say that, in some ways, well, I think we also need to be clear what our decision-making ability is with regard to this, which is pretty minimal around the edges. The utilities have a huge amount of power and they don't report to us, even if they're in our roadways. But I think with COVID, I think we've all come to realize how important it is to have fast internet access. And part of what Deanna has been pushing for that I think is really important is that this 5G network, to the degree that it can reach out and include some of our new affordable housing projects that are coming online, to make sure that this new technology will be accessible to more people in our community. So it's going to be an important project, and it's has the ability to dramatically increase people's connectivity.
Mary, the reason why I clicked the raise hand button, and Eve actually beat me to it, was to bring up the same issue. But I just wanted to add that it may be beneficial if maybe Jeff Grosser, as the municipal health officer, to get involved in this somehow in the communication, as and not just maybe Deanna's area with the engineering. And I understand, and that's great what you mentioned also, Mayor, that to let the public know, what are our limitations as far as what we can do, and our limitations as far as the decision making of utility installing new infrastructure. But yeah, but Eve, thanks for bringing that up, because that's what I was going to bring up. There's a whole lot of information circulating on the internet, and it's not to say that 5G doesn't have some health implications, but as Eve mentioned, the implications are minimal and depends for who, and it'd be great for us to so even just giving you a whole lot of support on it for us to get out in front of it. It will be publicly beneficial.
Great, thank you.
Thank you.
Are there any other staff reports?
Yes, Mayor. I just wanted to report to council. Over the last couple of weeks, the judiciary has asked those communities who can begin doing virtual court to begin that process. Our municipal court has worked with our IT department. They are actually ready to go, and this week they will be actually hearing roughly 30 cases virtually in our courtroom this week. So that should be in place, and we'll begin to run even more virtual court. In addition to that, they will be doing plea by mail.
Great, thank you.
Quick question on that, Mayor. I just wanted to ask Mark, how is our municipal courts considering dealing with the issue of defendants who may not have the best access to internet technology?
And again, that's why they're allowing for the mail to plea by mail.
Okay, so they just won't be involved on the sort of like the Zoom side.
Correct. That's right.
Thanks.
Okay, thank you. Okay, so I think we're done with reports for tonight, and we can move on to correspondence, which Ms. Niedergang referenced earlier. I think everybody was able to read this. I don't know, Eva's liaison to PEC, if you wanted to comment further. We'll just, for people who read it, it can help inform the work session discussion.
Yeah, I don't think there's much need as we go through some of our goals. It can be brought up, and I know that Heidi Fichtenbaum from the Princeton Environmental Commission is also here. So Heidi, feel free to chime in through the, maybe Mayor, you could repeat how to get comments in, or through the question and answer box.
Right. The easiest, if you're on a computer, is to use that Q&A button on the bottom of your screen, or you can send an email to Princeton comments, all one word, Princeton comments @gmail.com. So that brings us to our work session, which is doing an update on our goals and priorities list. And we would normally be doing this anyway around this time of year. But I thought this discussion was especially important at this juncture because I remember when we were putting these priorities together, we said that, look, there are going to be priorities that come up that we have no idea what they're going to be. There's no way we could have anticipated that. And that's certainly true this year in January. Nobody knew that we were going to be spending so much of our time on COVID-19 right now. But obviously the response to that has become a priority. And as a result, I think we need to take a look at some of the other things we had planned for this year. And in light of COVID, we might decide that some of them might rise up to a more urgent priority, especially things that will help the municipality conduct its business virtually. And there might be other items that, even though in January we had thought that they were super critical to do this year, we might want to put them aside till later in the year or next year. So I want to turn it over to Mark, who's going to be presenting some staff recommendations on how to reconsider some of our goals and priorities. But ultimately, this is a council document. And so I want to make sure we had a chance to discuss. And if there are enough changes, I think it's worthwhile bringing the list back again as a resolution and having us vote on it again. So it's very clear what are the new sort of revised priorities as a result of this discussion. So with that, I'll turn it over to Mark.
Thank you, Mayor. And as the mayor stated, our priorities have changed with the new COVID-19 pandemic hitting us. In that perspective, what we did was I asked the department directors to take a look at the goals and priorities that we established in early 2020 and really give council some perspective. And I think the important perspective is, how has the COVID-19 epidemic kind of impacted us? So I'm actually going to start at the bottom of this, give me one second, of this list where we really try to, give me one second, where we really try to look at what has a new COVID related issues that we'll have to deal with in 2020. And things have changed tremendously. Some very small things that we used to do have now become major issues. Just to give you an example, in our police department, in working with the court, a lot of confidential material moves from police to court. Usually that was a simple taking in a confidential document from downstairs, walking it upstairs, giving it to the prosecutor, giving it to the defendant, to the public defender, or giving it to the court. With COVID-19, that whole process has changed, and we were faced with a dilemma. We can no longer bring those documents up. We're now in the virtual environment. How do you securely move those confidential documents that were once very easily just walked upstairs, move it in a virtual environment in a way that is secure? That took over 2 weeks just to work that out between the municipal court, the prosecutor's office, the county, just to make those things work. So there's a tremendous amount of work that's going to go behind even the smallest things that we do. And what we have a group of employees that have gotten together to, how do we go to survive in this new environment? What are the things that we have to do? So some very broad kind of areas that we have to deal with. One of the things that we're going to have to deal with is just implementing new policies, personnel policies and procedures related to COVID-19, dealing with things in terms of leave. Laws have changed in terms of leave and how we deal with leave. There have been changes. There's going to be new policies needed for remote work. In addition to that, we're going to have to look at our new environment and determine what are the engineering controls to ensure we have social distancing as we operate. We're going to have to figure out a number of issues just dealing with personnel issues. When people come back to work, we're going to have to figure out how do we deal with operations. And with all the research we have done so far, it's going to be clear. It's going to be a phased in, gradual coming back to operations. So there's going to be modified work schedules we're going to have to put together. and manage those schedules. Managing just the employees' issues like health, mental health related issues, just reorienting employees to the new work environment and how do we work in a social distancing environment we're going to have to deal with. And then the development of an integration of new technology. Some of the things that we want to do is just reduce the amount of times residents have to come to the building. So we're looking at automating applications. A major project would be just looking at the building permit process will be an extensive process. And if we're working from home, we need to also look at file management and storage and how do we do that in this new environment and then improve and make permanent our remote access technology and policies related to that. This in itself will be a tremendous amount of work, and it should be the context that we use as we go back and kind of look at what do we have to do for 2020 and moving forward.
Actually, Mark, before you go back up, I think that I think we should just spend a little more time on that section of the new COVID related issues. I think this is a really good summary of the things that we need to do that are focused on the organization. But I also think that there's issues that have come up that are now pressing in the community as a result of COVID that we might want to add to our priority list. So I do think that I know there's been some issues that have been raised by different council members that I want to make sure that we include here and that we might add to in the course of this discussion. So two that I know of, and Michelle and David, you might want to add to these. So one is a review of the regulations that businesses may encounter when reopening, and to make sure there's some flexibility built into that. And I know that's something that Councilwoman Perrin-Lambros has been working on. And I don't know if you wanted to add anything in addition to that, Michelle.
Well, I was just going to say, I mean, we're starting the discussion now of how to remove or reduce, like parking space, space requirements, how to change the, when we change from one allowable use to another, that these regulations can be lifted. And I mentioned before my report that we're looking at, what other types of regulations we can change and help really streamline the processes that exist right now. And I think going hand in hand with that, when you talk about application automation, and we're going to go to website too, it all integrates into one thing. How we can do this virtually, making it streamlined and reducing the amount of documentation and, for lack of a better word, red tape to get these things done so that we can, streamline it and make it quicker. Because right now we really need to be, proactive.
Great, thank you. And then the other one to add to this, I think that the parking regulation is on here, and I was, 604, which I think is already here as a priority, but there might be additional. I think we should still keep on additional reviews of any regulations that businesses might be facing as they are reopening. The other one I wanted to add was about the re-envisioning the use of the streets and the curb space and the sidewalks. And David, did you want to say something additional about that?
I did, but I also wanted to say something additional about the parking regulations, because there are two ways that parking regulations can be adjusted. One is temporarily, and the other is permanently. And I was in a meeting with Michelle where we were talking with Derek Bridger about the fact that while businesses are gradually reopening and maybe having special social distancing requirements where they can only accommodate 25% of their customers, say in a restaurant, in those instances, you want significantly reduced parking requirement, which might then kick back in later on when things are fully back to normal. And then there are other kinds of parking waivers that you might want to consider to help a business get opened in a vacant space. And that has to do more with helping our economy recover, but it's a little bit more challenging in the sense that if you give somebody a waiver, a parking waiver for now to get them into a storefront, in 3 years, if the economy's back to normal, are you still comfortable with them having that parking waiver? So I just wanted to make that distinction and about the complexity of that particular issue. And the complexity of the revisioning the streets is similarly daunting in a way, because if it were just about making space, for people to use part of a roadway because there's not enough room on the sidewalk for appropriate social distancing, that would be easy. But when you come into the center of town and you put into the mix restaurants wanting to have tables out on the sidewalk because it's safer for their customers to eat outside, from what we're hearing about the spread of COVID, it's indoor environments are less safe than outdoor environments. That starts to possibly compete with sidewalk users. So that's where it starts to get really complicated. And well, we're working on it. But I do think it's a high priority that we, get this kind of thinking started now so that we're really ready to go when we start to reopen. So, I guess that's what I wanted to say about it.
Okay. But it does seem like there's been a lot of different groups talking about this, revising the streets to the point where my sense is that it is a priority of council members. I can't see everybody, so it's really hard. But at least if we can put it there, oh, here we go. Is that correct, that it's that council feels like this one is a high priority as a result of COVID? Okay, that I think it should be added here. And in addition to those two, I would say that, I know the health department's going to be busy with contact tracing. And I think we should probably have that listed as a goal of, training and maintaining an adequate number of contact tracers to contain the COVID outbreak. And the other goal that I think that has come up, that's a combination of work from Human Services and the health department, is ensuring that there's adequate housing and resources to socially isolate or quarantine people who've tested positive or have come into contact with somebody who's positive. And I don't know if anybody has any others that they feel like are new goals or priorities that should be added to the list that are directly COVID related.
So something that Civil Rights Commission has identified, and I know in collaboration also with Human Services, that has been identified is on the issue of, as much assistance that is available and organizations that have stepped up to provide assistance, not everyone has the resources to access it, to know about it. We have advocates that some of them that are the individuals who are accessing the resources are not, are because of an advocate that, or through word of mouth, but there's a concern that not everybody is aware through the regular means that we're using, whether it's through social media or the website. So there's an interest in working to identify other means of outreach so that we can provide the information about the resources that are available to ensure that they're reaching the individuals who most need it.
What form would that take, Leticia? Like what specifically is envisioned that's not already being done?
Well, right now, what is being done is like I said, typically in the past, it has been through word of mouth of someone going out into the community. And because of our health concerns, we can't do it through those methods. So, no, it's just working to identify. I know we've been doing our public relations. What's Fred's role?
Communications.
Communications is that as far as doing on social media and also working on doing it in multiple languages, the public announcements, but not everybody is online. So we don't know exactly what that would look like. So one of the goals is to work to identify, and perhaps it could be through, right now, I know that whenever there's meal distribution, that the community volunteers that are out there are practicing social distancing, but trying to communicate with those individuals who are receiving the meals to get an idea of what other needs there may be. And also using that opportunity to let those individuals know what type of assistance is available. But the concern is that we're not reaching everybody who needs it. And we don't know what the answer is yet, but certainly it's something that we need to work on.
Ms. Kern-Lambros?
Can I make a suggestion? Because it's a really good, valid point. I mean, I think we've made some strides in communication and, sometimes, forced to do that through doing the COVID daily updates and doing the weekly newsletter and having various channels for that information. But maybe we could put that as a priority and next step now under communications plan. And Leticia, if you could get with us and maybe discuss how we can reach and go to the next level. Because we've made certain strides, but that's the next step.
Right.
And I think if we could put that in the communication plan as another priority.
Yeah. And some can be more immediate enough. If I can just bring up another example for the weekly Zoom meetings through the PMA. I don't think any of our bodegas or other small businesses are on there. So, we should be able to inform them as far what the next steps are in opening.
Absolutely. And this came up in discussing the resiliency fund as well. We need to have an outreach because that's exactly the community we need to reach to help so that they can have access to the funding.
Exactly.
So we'll we can, I think as a priority, I absolutely agree with you. We should put that as part of the communication strategy.
Thank you.
Good point. Thank you. Mr. Williamson, did you have?
Yeah, I just wanted to mention Leticia's point goes back to my question to Mark about the municipal courts. About folks. Oftentimes the very people who are most distressed and most in need of assistance are the same people, because of their lack of resources, don't have access to the information about how to get a solution, right? So, and then Amia posed the question earlier about what's an alternative form of communication, and I guess the obvious thing would be mail. Some sort of, if people don't have access to internet, because that's what the municipal court is doing. So if folks can't come online to do online hearing, then they can plead by basically getting an affidavit and mailing it into the courts.
Right.
So
Thank
I
you.
mean,
Is there,
to translate to this one, it would I guess the almost the obvious solution would be they may have to identify some segment of the population who may need to receive some sort of hard mail as opposed to email or some of the other online form of communication.
Right.
are there any other COVID-related priorities people wanted to identify right now? Yeah, Mr. Cohen?
This is sort of a question for Mark. I don't want to assume that it's not being done, but I know that we have certain employees, who can't do their regular jobs because of the COVID shutdown. And I am curious whether there's something systematic being done to identify all of those people. And then, the two obvious things that they could be doing, one would be other work. And we've heard a couple of reports about that tonight, like the parking enforcement people helping with the contact tracing and the rec staff helping with delivery of food through our food support programs. But I know that there are some other ideas that have come up as well from some of the things I've been working on. I got an email from a resident who suggested, with the low automobile traffic right now in the Witherspoon Jackson neighborhood, there are a lot fewer cars parked on the street. And it's probably a really good indication of how many parking spaces residents use as opposed to visitors to town or employees. And wouldn't it be a great time to get somebody out counting cars? And
That's
that
a
would
great
help
idea.
with the permit parking. Yeah, it's a great idea. Help with the permit parking task force in terms of our data collection. Is there somebody who could help with that? I'm sure we've talked about that with the rebalancing the streets as well, that there might be some people in rec department who have public works kinds of skills that could help with repurposing streets if there was a little bit of temporary striping that was needed or putting cones out. So the question is there like a spreadsheet with all the employees who are underutilized and what their skills could be and how and people contributing, staff contributing ideas to how they could be best used rather than it being an unsystematic, somebody grabs somebody by the collar because they have a need and they don't happen to have anything to do.
Again, what we are doing right now, partially what we're doing is we're doing a lot of things where we're having people fit in needs. The one thing that's important too to realize, and I think through this whole discussion, is there's also a management component of being able to manage all of these things at the same time also that we have to consider. As you can see, just looking at all these projects that we're just identifying now and just returning to work and how much time and effort, we've got people working on those projects. And then we've got managers kind of managing those projects on top of everything. Again, we can get to a point where we're overextending our capacity. And I think that's important that there is a certain capacity that we can use, particularly on trying to manage different projects. Some of the things that you've talked about, if you have any ideas, what we do every day, our department head staff meet every day, and we go through all the issues that we have, where we can put resources, who can be used for what resources. So it's done in that matter. There's not a specific spreadsheet, but it's daily. We review these things on a daily basis. Department heads try to utilize our people. They're doing all kinds of different things, going cross departments to do things. But I think I guess one of the things that concerns me is all of those things also take management and someone managing a project, and we're doing a lot of projects right now. Just in—
Can I ask Mark, just sorry to interrupt, but do we even know how many employees are not able to do their job because of the situation we're in? I mean, that would be getting that baseline. I think
I can get you that. I don't have it off the top of my head, but I could get you that information.
And so this goes back to a question I asked, about 6 weeks ago, which is if the employees are not able to work because is there inability to work remotely due to a lack of some sort of IT connectivity issue? Is it an IT? And I think you mentioned we were gonna do an overview of that at the next IT meeting, looking at, what.
And it's not a connectivity problem in terms of people being able to connect. There's no issues. Anyone who needs connections or getting their connection. And again, a lot of this happened when we first happened. This was an event that happened all of a sudden. It took a lot of capacity out of our IT department to get everyone up and running in terms of being able to use to work remotely. And then there are just certain jobs that are not systematic to being done remotely. And then the other thing that we're doing is we're doing on modified schedule. There are a lot of people who are not, they may not be working every day, but they're working both remotely and coming into the office. So they're doing a combination of schedules. Part of the thing that we're also working on is trying to ensure that we don't infect whole departments. So we have departments who are working on kind of modified schedules where people are coming in every other day so that we don't have everyone in the office and we can do the social distancing. So there's a lot of things happening in those ways.
Okay, so as far as you know, there are no remaining employees who have work that they could do if all the systems, the IT systems were in place. In other words, it's more of a logistical thing. It's not that we don't have, it's not a remote, it's not that they could work remotely if we had the appropriate technology. That's what I'm trying to ask.
Correct. No, at this point, there aren't. Some of the only issues that we have are there are some systems that don't work really well remotely, but they work. And it may be more difficult to work remotely, but they do work.
Okay. I noticed, sorry, Jeff Cursor got back on, and I just wanted to see if you had something that you wanted to add.
Yeah, thanks, Mayor. I just, with regards to the budget discussion, prior to COVID-19, and I know Councilwoman Fraga was aware of this as well, we had a huge backlog in the number of uninsured or underinsured Princeton residents that were seeking healthcare access for children. And I'll give everybody a really brief rundown on how this works. If you are uninsured or underinsured, if you don't fit into New Jersey Family Care, which is essentially Medicaid, state's Medicaid for children, and you don't fall into the Children's Health Insurance Program, which was started under the Clinton administration, you actually have no insurance whatsoever. So the health department is a safety net coverage standpoint for children 6 months to 18 years to provide vaccinations, which obviously provides, routine disease screening, scheduled immunizations, and key to reducing death drastically in the youth, but then also there's the opportunity to expand that to the older adults in our community. I put in a request for this for the budget because I think that seeing what's happening with COVID, the one thing that I can say that's similar is that individuals that are uninsured or underinsured don't have a medical home. And when you don't have a medical home for COVID-19, you don't know who to call to get a prescription to go get a test for COVID-19. Sure, you can call telemed, but we all have a primary care physician. And it's so nice to be able to pick up the phone and say, hey, Dr. So-and-so, I think I'm feeling this. You know me. Can you write a script for me to go get a test? Well, a lot of people in the community can't do that. So part of the budget request was thinking about, is it possible to have our own local clinic and not require individuals to have to get sent over to Princeton, something similar to even like a Lawrence Township model where they actually have a well baby clinic. We could do that on site. We have our own pediatrician. We probably could utilize ambulatory care space with corner house and just use a patient room. Use there's vaccine fridges that are relatively inexpensive, and the vaccine would be free to a governmental agency. So it's something that we could do at a relatively low cost and have a tremendous impact on the community. So I just want to throw that out there and float that to the council, because seeing what's happened with COVID, having that doctor, that would be their primary care physician, and the town could provide it.
Seems like there are some nods going on. It seems.
Yes, and I also want to say
like
thank
a
you for
kind of-
that, Jeff, because I know we also discussed doing more outreach related to flu vaccines.
Yeah.
So we want to be able to provide them.
We did a survey, Councilwoman Fraga, last spring, I believe it was about a year ago, and we asked individuals in the uninsured population if they had a local doctor that they would go to, would they be willing to pick up the phone and call them anytime? And they said between that and the family member, those are the two people they would call. But they wouldn't necessarily call the hospital because they knew the hospital wasn't the town.
Mm-hmm.
And that's something that, listen, the health department's had a relationship with Princeton Hospital since it was built in the early 1900s. So that's always been a kind of a fixture of the health department to stand by. And there's nothing against it. We've always had a great relationship with them. But I think we're getting to a point in our community's development where we need to provide more local assistance where people can walk to our facility and be able to get these necessary vaccinations and preventative treatments.
Exactly. Thank you for that.
Yeah, I agree. And also, I think one of the things we know with COVID is that this is probably one of the most vulnerable populations as well.
Yeah.
So it's especially important now to make sure that we're doing everything we can to make sure that they're getting access to testing and to medical treatment.
Well, I thought that Councilwoman women, Lambros and Fraga, right, we have been working on the possibility of getting an urgent care center. Is there any, which I fully support your efforts on that. I'm wondering, is there any update on that, any progress?
From my end, the conversations I was in were specifically related to any potential that would be in relation to the new affordable housing, which is not something that's immediate, that's going to be, if it can happen, it's not going to be, and it's down the road. It's not something that we can address immediately.
Yeah, I can't say where it would be, but I have been working and there was interest by an urgent care provider. I assume that they just haven't gotten back to me because they must be inundated right now. But I will circle back and say that, I mean, this really highlights the need for us to have urgent care in town.
Definitely.
This is the kind of
Let me
disaster.
know, there is also another urgent care provider who's been very successful in the COVID crisis in a neighboring town who is interested in opening in Princeton. So
let's put it
Yeah,
together.
I just wanted to ask Mr. Grosser too. So my understanding is the urgent care facilities were private. They weren't necessarily facilities that would take you if you were uninsured, or does that depend on the urgent care facility?
So, yeah, I mean, to everybody's point, if we had an urgent care in town, we could partner with them, even if they were for profit, and we could have our own subcontract with them to provide these services. The Vaccines for Children program, VFC program, is a federally funded program where you can get free vaccines for children, and even expand it to older adults. I'm 99% certain you can't do that for a for-profit urgent care. However, to Councilwoman Sachs' point, if there's an urgent care in a walkable community, it's clearly a plus no matter what, right? I mean, people are there, we could work something out one way or another through either New Jersey Family Care or Charity Care, or even through the town supporting, free vaccines and us paying for them as part of our health department operating budget, which we've been doing for a number of years.
That would be amazing. Okay.
It's all about the walkability, because honestly, the access to medical care is a real problem. And a lot of individuals that are working many hours a day, it's difficult to get people over to the hospital. It just, no matter how easy you make it, it's difficult.
I know.
Well, especially because our community that is most vulnerable used to have a place that was walkable. That, it really has made a difference for our community not having that.
Yeah.
Can we put that back on our list of goals? We're getting more goals. We're adding goals. We're not taking.
Well,
more
I
goals.
think the urgent care facility was something that had been identified.
It's on there, and yeah, we need to highlight that. Let's
On
not.
there.
Yeah,
but I do need to say.
I will
one
say
thing.
though, to make it something that's doable this year, I think maybe the intermediate step is the one that Mr. Grosser outlined, which is to just have a facility that could live when it's in operation, a corner house or someplace, so that we have one locally. I mean, to be realistic, right now it's May. To have a agreement with an urgent care facility by the end of this year, I think is, I mean, I think we should keep it on the list as something that we're working towards. But a goal for this year, I think, should be to try to get something up that that is addressing the need that Jeff identified earlier.
Absolutely. Okay.
Sorry, Mark, we derailed your.
Yes, sorry, Mark.
I'm going to go back to the presentation, but one thing I do want to just focus in on is there's a lot of things that we're attempting to accomplish, and major things. I mean, we've got the affordable housing where we've got tight time frames. So I need to keep all of this in perspective as we look through this list. Let's go back to the top of the list. So what staff tried to do was take a look at, with all the things that we know we have to do in, quite frankly, half of the year related to the COVID-19. In addition, we have all the goals that we had previously stated. So the recommendations to give councils to make the decisions. The first one, I'm not going to go through all of them. I'll just kind of hit some highlights. The major one here was the development of the comprehensive GIS system. This is recommended from both administration and from engineering. One of the things that we see happening with the COVID-19, there's already a lot of IT issues we're going to need to deal with.
Mm-hmm.
Automation of the permit processing. We just believe this should be something that we look at in 2021 versus 2020, just based on what we have to do just to do the automation for this year.
Mark, can I just jump in because I had a subsequent, there was some correspondence earlier today, and then I spoke directly with Deanna to clarify. And so basically, you know, what I had requested was, what do you mean by deferral in practice? And when I spoke with Deanna, what she's recommending deferral on is the implementation of a comprehensive GIS system, which obviously is not possible this year. So the question is, what parts are continuing this year? And that was my question to you and Liz, is are there any parts scheduled to continue this year? And it seems that there are parts already related to other project or as part of engineering. And so that's what I would really like to hear is, and in fact, in your opening, when you were talking about, you know, building the permit process, there are a lot of things that you mentioned already that I think are related to GIS. And so, I mean, I just don't think we can refer to GIS as like, I mean, yes, comprehensive GIS, that's off the table. But it seems like there are still parts which are integral to our moving towards ease of remote access. And so that's my question, which parts are remaining?
And again, part of this is a lot of things that we will talk about in terms of just the automation will all lead into the GIS. Some of the file storage things that we're going to need to deal with will lead into GIS. This is more, when we talk about the comprehensive system, is a more system-wide. What I think we will accomplish this year is looking at some components of GIS that we implement. We're going to have to do, for example, some of the permit processing things. They should be done in a way to ensure that they can be integrated into a future GIS system. As we do all of this automation, it should be ready for future comprehensive GIS integration. So that's where I see this moving, us being able to get through this year.
Okay, well, it would just following up, like between now and the IT committee meeting, it would be useful to see on paper which parts of the components that will add up to comprehensive GIS are still on the table this year, and which departments they're connected to, because I see that, engineering was asked to weigh in on this, but actually, the part of GIS that, for example, I was most concerned about was in the planning department. Engineering already has S3 and they have, a lot of functionality. I was actually much more interested, in the rollout for planning, because I think that cuts down on staff time, and also cuts down on OPRA requests, and also makes it easier for government to function in the current environment. So if we could just, have some of that on paper by the committee, the IT committee meeting.
Sure.
And
I'll go
also
to some of the ones we've already identified, and then I can give you a better list.
and just finally, what about GovPilot then?
I would say this, I don't want to, I'm going to suggest that you don't wed yourself to any program. We need to look at this comprehensively and figure out what works best. So I don't want to say GovPilot is the right tool, but a tool similar to that, I think we should be looking at. That would allow people to have access to things like, one of the things that I thought was most important with the GovPilot were things like looking up your information in terms of property record information that are frequently asked of residents for zoning, looking up the zoning on a property, looking up the property record information. Those types of things I think we can still move forward with.
So Mia, I think you're making a good point here. So this document, I'm hoping is going to come back to council, ideally at our next meeting where we can vote on it. But for something like the GIS, if the IT committee is going to be meeting in the interim, if you're able to help reword what this should say so that it's more accurate as to what the goals are for this year that are achievable, that would be useful for everybody.
Okay, I'm going to move along. I'm going to go down to the health department. There are a number of issues in the health department. There will be a number of supplemental requests. Jeff talked about a little of those in terms of additional staffing needed for nursing staff, additional environmental specialist staff, and we've seen those. So those are things that we'll have to evaluate. Part of the things asking for the deferral were the dog licensing, increase that percentage, the access to the affordable behavioral health services, and the zoological diseases. I'm just running through a couple of those if there's any questions there, and then the cannabis piece.
Yeah, and I would just make a note that the goals that were in red were the ones that were super high priority. So I think those are the ones that we should be especially making sure we're not glossing over tonight if they're being deferred. The orange ones were already ones that we'd like to try to get to after we get to the red ones. And if they don't have a color, then it was ones that we were skeptical we were going to get to this year anyway. So the fact that those are being deferred, given our prior conversation, I think would be of less concern to council. But and I think we all understand why those high priority goals that were under health department are now being deferred, because obviously health has other things that they're dealing with.
Okay, so I'll move on then. Then a lot of these then will fall under, in terms of things that were deferred, will fall into a lot are in the orange category. I missed one. Let me go back. So the one goal that we're asking for a deferral is the stormwater management and the stormwater utility component of that. One of the reasons for that is that some new rules I believe they're coming, oh no, the stormwater utility needs to be established. There must have the master plan and flood mitigation plan in place.
Mark, that wasn't gonna get done this year in any case, maybe preliminary conversation. So I'll defer to David on that one, but I don't think that's a big deal to say we're deferring it, since I don't think that was gonna happen this year anyway.
Sorry, it's hard to move this thing around. The rest of these are all. The next one is the fuel station.
Okay. But we passed and we've done the canopy, and we're doing the screening around the fueling station. So this would be a continuation on the same track, and we're deferring. You're recommending to defer it completely.
No,
no, this is
deferring the, there was no decision made about the drain.
Right.
correct.
I think that's what he's deferring.
Right.
That's correct.
That would be any additional work then. So the work
That
is going to be completed, though, that we've already started and authorized and budgeted.
That's correct. No additional work outside of that work.
Okay.
The next one is the implementation of the Nassau Streetscape, and I believe this is not including the Bank Street work. So it's
Okay.
additional work.
Right. The Bank Street work, I think we've already budgeted for, and that's
Correct.
already kind of underway.
Correct.
And it will be important to have this streetscape because of, the current situation.
But that was what this was supposed to be. It was supposed to be the implementation of the Nassau Streetscape plan from Bayard Lane to Chambers, I believe. Is Deanna still on?
I'm still on. I'm here.
That was.
So,
are you referring? I don't think you were not referring to the Bank Street, are you?
no, Bank Street's already part of a project that hopefully will go out to bid soon if we get state approvals. This was more for the work related to, say, the installation of the benches and also with the tree planting project. We can look to move that ahead if there is still, the desire to get the trees planted this fall. I just, in light of everything that's going on, I just put it as a recommend deferral at this point, but we can look at bringing it back.
I actually think that the disruption of that kind of work happening on Nassau Street when we have a shortage of sidewalk space with social distancing and everything, I think it's not actually the right time to be, closing down parts of the sidewalk to let people come in and do work.
That's a good point. I think, are you talking past Bank Street all the way? You're saying all the way to Chambers Street?
We were looking for, the tree planting was going to occur from Witherspoon to Van Deventer.
I would sort of argue the opposite, that I think this is, I think that we've heard that fall is a better time to plant than spring. And so you're delaying it quite a bit. And we've lost so many really enormous trees on Nassau Street, and it's part of what gives the downtown its character. And in some ways, maybe there's going to be fewer cars there during this period potentially, and it's a good time to do it when it's maybe less disruptive. I don't know. I mean,
it's also something that can be done in a socially distanced way. I mean, we've talked about staff and potentially other people who want to lend staff, and this is something that could be done in a safe way, and I totally agree.
And it's a wide sidewalk area too. Yeah. So and you don't have that many restaurants that really need to be on the sidewalks. They already are. So,
More,
and I just think beautification right now, I mean, we want to be as attractive as possible because we may, you know.
more of the challenge comes in putting together the plans and the bid documents for a project like this, because it would have to go out to bid by July. And we're still experiencing some challenges in doing our AutoCAD plan preparation work with social distancing and remote access. And so that's where I'm just not sure if we can get everything together in time for a July
Okay.
so
bid
Deanna,
frame.
Deanna, to your point, so that's exactly an example of what I'm talking about, of work that is not able to happen because the technical capacity is not there. So can you, right, the AutoCAD stuff? I mean, what is needed in order for staff to access that remotely?
Well, we're actually working on a plan with IT for people to bring their computer workstations home. But everything in the office is a wired system, where at homes you usually have a wireless system. And so just changing out the technology from a wired system to wireless, you have to then get like this wireless thing that I don't even know all of the technology, but it basically, our machines don't have wireless capability at the office, and we have to build in something that allows for them to have the wireless capability.
Okay, well, I know Liz is going to say take this to the IT committee, but I just want to say, you know, David, you use AutoCAD at home. You know, Mark, can you put this on the agenda for the IT committee, because it's such a big.
I have got a solution for you, but we'll take it to the IT committee.
All right. We need to move soon. Yeah. No. Okay. All right.
But I do think that even regardless of the tree planting, I do feel that implementation of the Nassau Streetscape Plan is going to be happening this year through a major project that I think should be one of our goals, because I think it is going to take time, which is that project that goes from Bayard to Chamber Street.
I think it's important. I think the beautification and maintenance is really important.
Right.
So try to get Deanna what she needs and her staff what they need, which is needed anyway.
And
Yep.
it's a matter of productivity, and you know, and bringing in. So maybe we put that back on the COVID related goals that we need to add, is to really bring us up to the IT level that we need, which I don't really understand, but I understand we don't have it, and we need it because that makes us more productive.
Yep.
Okay, thanks.
Mark, you still here?
Yep, I'm here. Wasn't sure if everyone was finished. Those are really all of the issues that are red issues in terms of deferrals.
Great.
Okay.
So I would say that between now and the end of the week, just so that we can have this back for our next meeting, I would ask everybody on council to take another look at this pretty closely. And everybody had goals that were associated with their name. And if you can go back and look at the goals that you have ownership over, and get back to Mark with your progress on those, or the progress on those. So whether it's already started and underway. And I think we were supposed to at some point have had a calendar associated with this that I don't know if ever got produced. So you know, I think that this is a good opportunity to go back and do that, to fill in some of the dates of when you expect those deliverables to be. And, you know, I think there's a few of these goals that we can cross off the list too, which is great to be able to say that they're done. So hopefully that was clear. But anyway, go back through the goals that have your name associated with them, and I'll try to send out a reminder email. But if it's complete, that's great. If it's not complete, to break it up into what you think you can accomplish this year, and what those intermediary deadlines look like. Okay. Are there any other comments before we move on? Okay. Thanks, Mark.
Thank you.
Okay, we have a ordinance introduction for tonight, and I have one minor correction, or major correction, I guess, major minor. When I read this, the public hearing for this will not be meeting on Memorial Day. That meeting is on a Tuesday, not a Monday. So the public hearing will be on May 26th. And it's just a reminder for council to also mark your calendars that our next meeting is on May 26th, not May 25th. So this is ordinance 2020-13, an ordinance by the municipality of Princeton regarding illicit connections and dumping of materials to Princeton's stormwater sewer system, the feeding of wildlife in Princeton's parks and on other municipally-owned properties, the removal of pet waste, littering, and the collection of grass clippings, and amending the Code of the Borough of Princeton, New Jersey, 1974, and the Code of the Township of Princeton, New Jersey, 1968. Who's here who can wants to give the brief description of this ordinance? Ms. Stockton?
I can do that, sure. So back in 2018, the municipality was audited for our stormwater program. We have a permit issued by NJDEP for the stormwater effluent that is released from the town. And as a result of the audit process, when we were reviewing specific model ordinances that NJDEP has versus what was in our municipal code book, we found that there were certain tweaks that needed to be done just to be fully compliant. In some cases, it's just the addition or a change of a definition. In other cases, I think we added a purpose statement in one of the code sections. In another section, there is a little bit more additional information added in. So this is really it's a housekeeping ordinance amendment. It's nothing substantially changing the way we operate in regards to these items.
Sorry, can you hear me? Okay, my headphones just went out, so I lost everybody for a second. Okay, so are there any questions for Ms. Stockton? No, okay. In that case, is there a motion to introduce?
Moved.
Moved by Mr. Cohen.
Second.
Seconded by Ms. Niedergang. Any further discussion? All right, Madam Clerk, please call the roll.
Ms. Perrone Lambros,
Yes.
Ms. Niedergang,
Yes.
Mr. Cohen,
Yes.
Ms. Fraga,
Yes.
Mr. Williamson,
Yes.
Ms. Sachs, I'm sorry.
Yes.
Okay, the ordinance has been introduced by unanimous vote, and the public hearing will be on May 26th, 2020. And I just realized I want to go back to our discussion about the goals. There was a comment that came in on the Q&A that I wanted to read into the record. I apologize for not doing this when we were discussing the goals. This is from Heidi Fichtenbaum from the PEC. And she said, just want to support the goals of the PEC and the letter from PEC. We are interested in being sure that the affordable housing and green building element are coordinated. And I think that council shares
Second the
that.
motion.
What's that?
Second the motion.
Okay, excellent. Yeah, so we'll make sure that if that's reflected in the language, if not the spirit of what we're going to be working on this year. Okay, so now we move on to resolutions. The first is 2171, resolution authorizing the award of a contract to SHI Corporation for website redesign to be performed by Civic Plus for the municipality of Princeton, amount not to exceed $69,221.65 for a 4-year contract. Is there a motion to approve?
So moved.
Moved by Ms. Pearl-Lambros. Is there a second? Seconded by Ms. Sachs. Any discussion?
No, I just want to say I'm really glad that we're moving forward. I think the timing is really good. It's a good time to be cleaning up pages, and there's been some really good feedback from various residents in the ADC. So I think it's really terrific that we're doing this.
I do have a question, and maybe Councilwoman Pearl-Lambros was just referring to this, since I'm sure this has come before the IT committee, but I just wanted to be sure that there is citizen involvement in reviewing any new website and beta testing. And, you know, I don't want to just deliver this to the population of Princeton without users, you know, some kind of user survey, because the current website is so difficult to navigate and inscrutable. I mean, I do the best I can, but many websites are much easier to use, and that would be a key goal. So I hope that we'll get lots of citizen and user involvement in that process.
Well, it was actually coincidentally that it happened that the Economic Development Committee had formed a subcommittee and had really gone beyond and looked at a lot of different communities' websites, and they liked like Trenton and Asbury Park and some others. And when they did their presentation, it just coincided with the same time we were looking at Civic Plus. And in fact, some of the websites that we liked with Civic Plus happened to be the ones that the Economic Development Committee had liked. So I've put them in touch, and I've shared that, but once we get on board and start really doing the designing, I'm going to have that subcommittee connect with Christina and Jeff, and we will get that feedback, but maybe even a broader feedback even further down. Right?
Yeah, I mean, not just the merchants, but other, homeowners as well. So
that was
thank you.
Thank you.
Yeah, and just to be, oh yes, sir, Ms. Sachs.
I just want to say to Eve's point, which was actually what I was going to say before, was to thank Jeff and Christina, who really did a tremendous amount of research and came up with what I think is a fantastic choice, and asked us to weigh in on a lot of options, and we sort of all independently ended up coming to this. So thank you, Jeff and Christina. Really, it was a great choice, I think.
Yeah, I agree. And one of the nice things about Civic Plus is that it is in a lot of ways the standard website for a lot of municipalities. They specialize in municipal websites. They're on the state contract, which is why we were able to move forward with this relatively quickly. And one of the things that we're getting with them is a sort of set design. And even though, we are special in Princeton, and I think one of the things that makes our website special is that we have so much information on it, which is really important for us to be able to communicate with our residents, that a lot of the design is already there. So I want to be clear that council should be clear, and I think the public should be clear that that's in part what is useful about this. Like, we're not putting together another committee to design a website, that we're using a website framework that's already been designed for municipalities, that's used by hundreds of municipalities. So a lot of the beta testing and everything else that Eve, you're mentioning has already been done not just by a group of residents, but by hundreds of municipalities. So we're able to.
I'm
take advantage of
thrilled to hear
work.
that. Thank you. And
Yes.
thank you, Jeff and Christina.
Well, no, Mayor, I just want to jump in real quick. Christina from Access has been doing a tremendous amount of research on websites over the last few years. She's been going to a lot of different seminars, really, throughout the region. And Seamless was kind of a jumping off point for us 3 years ago. And we made strides with it. Obviously, there's a lot of lessons learned, but thanks to the IT committee and the feedback from the EDC, Councilwoman Pearl-Lambros and Sachs, I think, we're getting some good feedback, and Councilwoman Fraga, sorry, we're getting good feedback from the community through those channels. And I think a lot of it's happening and we don't even realize it's happening sometimes. But the RFP that was directed to us from Civic Plus, it's cool to see how it's happened, because 3 years ago we had this very rigid request for what we wanted in a website. And through just learning all of the deficiencies that we've come across just by using the system and by soliciting feedback and not being too defensive about it, we've actually understood really what works and what doesn't. And I think the new program through Christina training all the departments, I think you're going to see all the departments having their own capability to change stuff real time. And I think that's cool. And that's what we need to get to. So, a lot of kudos to Christina and support from the IT committee. I really appreciate that. And thank you for passing the resolution.
Great, thank you. And thanks, Christina, if you're listening. Okay, next resolution is, does somebody else?
I'm sorry, did we actually vote on this?
Oh, maybe we didn't, thank you. All right, I think it's been moved in second.
I may have wandered, my
Thank
attention
you.
may have wandered
No,
for a
it's like,
second.
yeah.
Okay.
I got like coronavirus brain. Okay, all in favor?
Yes, aye.
Any opposed? Okay, resolution passes unanimously.
Thank you, thank you, Jeff.
I'm gonna blame it on Jeff for thanking
I
us for
passed
passing it.
I don't think I have that authority. Oh, sorry.
All right. Next is 2172, resolution in support of NJDEP's denial of all permits for the Northeast Supply Enhancement NESE project. Is there a motion to approve?
I would like to do that.
Okay, moved by Ms. Niedergang, seconded by Ms. Sachs. And this was referenced earlier by Ms. Niedergang as coming from the PEC and their recommendation. Is there anything else you wanted to add before we take a vote?
No, I mean, just that this is something that has been rejected. I mean, it's supposed to bring energy supplies to New York, although we believe it's really intended for overseas supply. That has been rejected by both the mayor and the governor of New York, and the potential environmental implications are really dire. So it's a terrible idea, and hope the Department of Environmental Protection turns them down again. But
great, all in favor?
Aye.
Any opposed? Resolution passes unanimously. Next is 2173, resolution authorizing a professional services agreement in the not to exceed amount of $15,000 with McMahon Associates Incorporated for traffic engineering services related to affordable housing development near Turkey Road. Is there a motion to approve?
So moved.
Mr. Cohen, is there a second?
Second.
Seconded by Ms. Pearl-Lambros. Any discussion or questions? All in favor?
Aye.
Any opposed?
Aye.
Resolution passes unanimously. Next is 2174, resolution authorizing a professional services agreement in the not to exceed amount of $5,000 with McMahon Associates Incorporated for on-call technical assistance for emergent traffic engineering issues. Is there a motion to approve?
I'll move.
Moved by Ms. Fraga and seconded by Mr. Cohen. Any questions or discussion? All in favor?
Aye.
Any opposed? Resolution passes unanimously. And next is 2175, resolution authorizing a professional services agreement in the not to exceed amount of $15,000 with Kleinfelder for on-call technical assistance as required for sanitary sewer infrastructure. Is there a motion to approve?
So moved.
Moved by Mr. Cohen, seconded by Ms. Sachs. Any questions or discussion? All in favor?
Aye.
Any opposed? Resolution passes unanimously. And next we come to the consent agenda, which contains items of a routine nature passed by a single vote. Are there any items anyone would like removed from the consent agenda? And then there's a comment I received that somebody asked me to read, even though we normally don't comment on things on the consent agenda. And this is just a thank you. It's from Lex Kochman from Habitat for Humanity. And she wants to thank all the community leaders of the Witherspoon Jackson Historic District, town council members, Mark DeShield, Elizabeth Kim, Derek Bridger, John Petnati, and everyone at various steps along the way has lent an enthusiastic hand in helping this come to a reality. And the two families are so excited they may be in their new homes by Christmas.
Awesome. Beautiful.
Is there a motion to approve the consent agenda? Moved by Ms. Fraga,
Second.
seconded by Ms. Niedergang. All in favor?
Aye.
Any opposed? The consent agenda passes. And is there a motion to adjourn?
So moved.
Second.
All right, moved by Mr. Cohen quickly, seconded by Ms. Sachs, and all in favor.
Aye.
Aye.
All right, meeting is adjourned. Thanks, everybody. And have a
Thanks.
good
Be
night.
well,
Thank you.
everyone.
Good night.
Good night, everyone.
Be well.
Good night.